Hi friends, welcome to the channel The Nurse. Here we are discussing about nursing ethics related questions and answers. And if you are not subscribed to our channel, please subscribe and we will go to the topic nursing ethics questions and answers. Nursing ethics MCQs 2023. First question. A nurse has just received an order from a physician to administer a medication to a patient. The nurse knows that this medication is contraindicated for the patient based on their medical history. What should the nurse do? Administer the medication as ordered, hold the medication and notify the physician of the contraindication, administer the medication at a lower dose, consult with another physician to confirm the order. So here correct answer is hold the medication and notify the physician of the contraindications because it will harm the patient condition. So nurse should not administer the medications. The nurse has an ethical obligation to advocate for the patient safety and well-being. If nurse is administered the contraindicated medications, means patient will get problems. So nurse has the responsibility to advocate for the patient safety and well-being. Administering a medication that is contraindicated could cause harm to the patient. The nurse should notify the physician of the contraindication and suggest alternative medications. Second question, which of the following is an ethical principle that guides nursing practice? Autonomy, utilitarianism, virtue, care. Correct answer is autonomy. Autonomy is an example of ethical principle. Ethical principles are general rules that help nurses make ethical decisions. Autonomy is an ethical principle that means respecting a patient's choices and self-determination. So autonomy will give the power to the patient to decide his treatment. Utilitarianism, virtue and care are not ethical principles, but they are examples of ethical framework that are systematic approaches that help nurses analyze and resolve ethical dilemmas. So utilitarianism, virtue and care ethicals are examples of ethical framework that helps to nurses to solve ethical dilemmas. So I will give you an idea about ethical principles. First one is autonomy. This is ethical practice recognize the patient's right to make decision about their own healthcare. Nurses must respect the patient's decision even if they do not agree with them. So first one will give permission to the patient to take a decision. Second one is beneficence. This ethical practice involves doing what is the best interest of the patient. Nurse must strive to promote the patient's well-being, prevent harm and provide quality care. So beneficence means maximum benefits oriented nursing care. Same time non-maleficence. So that means it mainly focuses on reducing the harm. Non-maleficence, that is ethical practice requires that nurse avoid causing harm to the patient. Nurse must prevent harm, minimize risk and protect the patient from harm. So that is non-maleficence. Next ethical principle is justice. Justice means equal care. It focuses equal care to the all patients. Justice means it is an ethical practice requires that nurses treat all patients fairly and equally without discrimination or favoritism. Nurses must provide care based on the patient's need, not their personal biases. Then fifth one, fidelity. Fidelity means the ethical practice involves being faithful and keeping promises. Nurses must honor their commitments to patients, colleagues and the nursing professions. Then last one is veracity. Veracity is another example of ethical principle. It involves being truthful and honest with the patients. Nurses must provide accurate and complete information to the patients, including information about their health status, treatment options, and potential risks. Third question, what is the ANA Code of Ethics for nurses? A set of legal rules that nurses must follow, a set of moral values that nurses must uphold, a set of professional standards that nurses must adhere to, a set of ethical frameworks that nurses must apply. Correct answer is option C, that is a set of professional standards that nurses must adhere to. That is ANA Code of Ethics for Nurses. ANA Code of Ethics for Nurses is a set of professional standards that nurses must adhere to in their practice. It consists of 9 provisions that outline the ethical responsibilities and obligations of nurses to patients, colleagues, society, and themselves. The ANA Code of Ethics Nurses is not a set of legal rules, moral values, or ethical framework, but it may be influenced by them. It is a professional standards or guidelines of that nurses should follow, but it is not a legal rules or moral values or ethical frameworks. Fourth question, a nurse is caring for a patient who is refusing treatment for their condition. The patient family is pressuring the nurse to persuade the patient to accept treatment. What should the nurse do? So here you need to apply the ethical principle. First option is persuade the patient to accept treatment to satisfy the family's wishes. Respect the patient's autonomy and allow them to refuse treatment. Seek a court order to force the patient to accept treatment. Consult with another nurse to determine the best course of action. Correct answer is option B, that is respect the patient's autonomy and allow them to refuse treatment. That is what the first principle, autonomy. The nurse has an ethical obligation to respect patient's autonomy and right to make decision about their own care. Persuading the patient to accept treatment against their will would violate their autonomy and could lead to a breach of trust between the patient and healthcare providers. Then fifth question, which of the following is an example of an ethical dilemma in nursing? A nurse has to decide whether to report a colleague who made a medication error. A nurse has to decide whether to follow a patient's advance directive or a family's request. A nurse has to decide whether to accept a gift from a grateful patient. A nurse has to decide whether to join a union or not. Ethical dilemmas means there will be a conflict between ethical principles. So to apply ethical principle, there will be a conflict, there will be a confusion. So that condition is known as ethical dilemma. So in this option, which one is example of ethical dilemma? So here correct answer is option B. A nurse has to decide whether to follow patient's advance directive or family's request. So here patient's advance directive, that may be example of autonomy, and family's request, that may comes it will be a beneficence. So there is a conflict between autonomy, first principle autonomy, with second principle beneficence. The ethical dilemma is a situation where there are two or more conflicting ethical principles or values that must be considered. In nursing, ethical dilemmas can arise when there is a conflict between nurse's duty to promote the patient's well-being and the patient's autonomy or the family's wishes. Option A is not an ethical dilemma, but rather a matter of professional responsibility. That is, reporting a colleague who made a medication error is required to maintain patient safety. So it is a nursing professional responsibility. First option. Then option C is an ethical issue but not a dilemma. Accept gift from a patient can be seen as a conflict of interest and may affect the objectivity of the nurse's care. However, it does not involve conflicting ethical principles. So if there is a conflicting ethical principle, means it is an example of ethical dilemma, but it is a example of ethical issue. Then option D, it is not an ethical dilemma, but rather a personal decision. Joining a union have professional and personal implications, but it does not involve conflicting ethical principles. Sixth question, what is a moral distress in nursing? The feeling of being unable to act according to one's moral values, the feeling of being uncertain about that is morally right, the feeling of being conflicted between two or more moral values, the feeling of being harmed by someone else's immoral actions. Here correct answer is option B. Moral distress in nursing means the feeling of being unable to act according to one's own moral values. Option B, that is an example of moral uncertainty. Then option C, that is an example of moral conflict. Option D, if the feeling of being harmed by someone else's immoral actions, that is an example of moral injury. Moral distress is the feeling of being unable to act according to one's own moral values due to external constraints such as organizational policies, lack of resources, or power imbalances. Moral distress can cause nurses stress, burnout, dissatisfaction, frustration, anger, guilt, shame, anxiety, depression, or even PTSD. So these are the complication of more persistent moral distress. Then which of the following is an example of applying principle of justice in nursing practice? So this is another ethical principle, justice. So I explained in previous question, so you can answer here easily. So example of justice: providing equal access to healthcare for all patients regardless of their social status, providing individualized care for each patient according to their needs and preferences, providing compassionate care for all patients regardless of their diagnosis or prognosis, providing truthfulness information to all patients regardless of their ability to understand. So here correct answer is that is example of justice in nursing. That is first option, providing equal access to healthcare for all patients regardless of their social status. That is giving care equally irrespective of their social status or their economical status. Option B, that is example of applying principle of autonomy. Then option C, that is an example of applying principle of veracity. And option D, providing truthful information to all patients regardless of their, this is an example of veracity, truthfulness, and providing compassionate care for all patients regardless of their diagnosis or prognosis. That is an example of applying beneficence. So option B is an example of autonomy, option C is an example of beneficence, option D an example of veracity. These are the other ethical principles. Justice is an ethical principle that means treating people fairly and equitably. In nursing practice, justice means providing equal access to healthcare for all patients regardless of their social status, race, gender, religion, or any other factor. Option B is an example of applying principle of autonomy. C is an example of applying principle of beneficence. Option D is an example of applying principle of veracity. Then eighth question, which ethical framework is based on the idea that right action is the one that produces the most good or least harm for the greatest number? Option A, deontology. Option B, utilitarianism. Option C, virtue ethics. Option D, care ethics. Here correct answer is option B, that is utilitarianism. Utilitarianism is an ethical framework that is based on the idea that the right action is the one that produces the most good or least harm for the greatest number. It focuses on the consequences or outcomes of the actions rather than the intention or motives behind them. Deontology, that is another ethical framework, is an ethical framework that is based on the idea that the right action is the one that follows a universal duty or rule regardless of consequences. Then virtue ethics is another ethical framework that is based on the idea that the right action is the one that reflects a good character or virtue rather than a rule or outcome. Then fourth option was care ethics. It is also an ethical framework that is based on the idea that the right action is the one that fosters caring relationship rather than abstract principles. So in care ethics, it will mainly focus on sympathy, empathy, and all. Virtue ethics, that is we need to give focuses on the outcome. Virtue ethics that focuses on the intention of the work, not focused on rule or outcome. The ninth option, what is the informed consent in nursing practice? A process of obtaining permission from a patient to perform a specific procedure or treatment. The process of providing information to patient about the risk and benefits of a specific procedure or treatment. The process of ensuring that a patient understands and agrees to a specific procedure or treatment. The process of respecting a patient's right to refuse or withdraw from a specific procedure or treatment. So, informed consent means the process of ensuring that a patient understands and agrees to a specific procedures or treatment. Informed consent is the process of ensuring that a patient understands and agrees to a specific procedure or treatment. It involves providing information to a patient about the risk and benefits of the procedure or treatment, the alternative, and the right to refuse or withdraw from it. It also involves obtaining permission from the patient to perform the procedure or treatment. Informed consent is an ethical requirement that respects patient autonomy, veracity, and non-maleficence. 10th question. Which of the following is an example of ethical issue related to confidentiality in nursing practice? A nurse shares a patient's medical record with another nurse who is not involved in the patient care. A nurse discusses his patient conditions with the patient's family without the patient's consent. A nurse reports a suspected case of child abuse to the appropriate authority without the patient consent. A nurse refuses to disclose a patient's HIV status to another healthcare provider who is at risk of exposure. Here, correct answer is option D. A nurse refuses to disclose a patient's HIV status to another healthcare provider who is at risk of exposure. So that is example of ethical issue related to the confidentiality in nursing practice. Confidentiality is an ethical principle that means protecting the privacy and personal information of patient. In nursing practice, confidentiality means respecting the right of patients to control who has access to their medical records, diagnosis, prognosis, or other sensitive information. However, the confidentiality may be breached in some situation where there is a legal obligation or moral duty to protect others from harm. Option D is an example of ethical issue related to confidentiality because it involves balancing the right of the patient to privacy and the right of healthcare providers to safety. So, if we are not informing the HIV status to another healthcare provider who is at risk, then that is a breach of confidentiality. Same time, it will be the breach of healthcare providers' safety. Option A, B are examples of violating confidentiality without any justification. Option C is an example of breaching confidentiality with legal justification. 11th question. Which ethical framework emphasizes caring both an emotion and an action that guides moral decision making? Deontology, utilitarianism, virtue ethics, care ethics. Correct answer is care ethics. So care ethics mainly focuses on caring both an emotion and an action that guides moral decision making. Care ethics is an ethical framework that emphasizes caring as both an emotion and an action that guides moral decision making. It focuses on relationship between people rather than abstract principles or rules. It also recognizes the diversity and complexity of human situations rather than applying universal standards of outcome. Care ethics is especially relevant for nursing practice because it reflects the core values and goals of nursing as a caring profession. 12th question. Which of the following best describes moral uncertainty? A situation where nurses have no ethical guidance or rules to follow. A situation where nurses have conflicting ethical guidance or rules to follow. A situation where nurses have doubts or uncertainty about the ethical course of action. A situation where nurses are unable to make ethical decisions due to lack of knowledge or experience. Moral uncertainty means a situation where nurses have doubts or uncertainty about the ethical course of action. Moral uncertainty refers a situation where nurses have doubts or uncertainty about the ethical course of action to take. It occurs when there is a lack of clarity or ambiguity in ethical guidelines or principles, making it difficult to determine the right course of actions. There will be similar ethical principle or which one is nurses has to apply in that particular cases. Then there will be a uncertainty. So that cases is represents moral uncertainty. In which of the following best defines moral conflict? A situation where there is a clear ethical course of action to take, a situation where nurses have doubts or uncertainty about the ethical course of action, a situation where nurses have to choose between two or more conflicting ethical principles or values, a situation where nurses are unable to make ethical decision due to lack of knowledge or experience. So from this you can easily find it out. Moral conflict means a situation where nurses have to choose between two or more conflicting ethical principles or values. So similar ethical principle will be there. There will be a confusion. Two or more ethical principles will be there. Then there will be a conflict, that is more known as moral conflict. Moral conflict refers to a situation where nurses have to choose between two or more conflicting ethical principles or values. It can arise when two or more ethical principles or values are in conflict and the nurse must make a decision that upholds one's value while compromising another. So nurse has to compromise some ethical principles to apply best one. 14th question. Which of the following is an example of moral injury or moral injury in nursing? A nurse who is uncertain about the ethical course of action to take in patient's care, a nurse who is experiencing emotional distress after making an ethical decision, a nurse who is forced to act in a way that violates their ethical values, a nurse who experiences cognitive dissonance when faced with ethical dilemmas. Ethical moral injury means a nurse who is forced to act in a way that violates their ethical values. It will leads to moral injury. Moral injury refers to a situation where a nurse experiences emotional distress or moral suffering as a result of acting or witnessing action that go against their ethical values. An example of moral injury in nursing would be a nurse who is forced to act in a way that violate their ethical values, such as participating in a procedures they believe in morally wrong. 15th question. What is the focus of virtue ethics? The consequences of actions, the moral rules and principles that guides action, the character traits and virtue that enables individuals to act ethically, the social and cultural context of ethical decision making. Virtue ethics means the character traits and virtues that enables individuals to act ethically. Virtue ethics focuses on the character traits and virtue that enables individuals to act ethically. It emphasizes the importance of cultivating virtues such as honesty, integrity, and compassion to guide ethical decision making rather than relying solely on moral rules or principles. Then we will move to the last question of this video. Which of the following is a potential benefit of nursing virtue ethics in nursing practice? It provides clear and objective guidance for ethical decision making. It emphasizes the importance of following established ethical rules and principles. It encourages nurses to develop character traits that enable ethical behavior. It emphasizes the importance of individual autonomy in ethical decision making. So here correct answer is it encourages nurses to develop character traits that enable ethical behavior. Potential benefit of using virtue ethics is nursing practice is that encourages nurses to develop character traits that enables ethical behavior such as honesty, integrity, and compassion. By focusing on this trait, virtue ethics can help nurses to cultivate a moral compass that guides their decision making even in situations where there may be no clear rules or principles to follow. So that is about today's video. It is a rough topic, so I think you will get a better idea. So you can go to our website, thenursepage.com, to understand ethical dilemmas. So I have explained clearly there regarding ethical dilemmas. So you can understand very well there regarding nursing ethics and ethical dilemmas there. So if you have any doubt, means you can still comment in comment sections, or you can share with your friends also. So thank you. So we will come with another video soon. Thank you.